today's topic is syphilis, sexually transmitted disease which is caused by the bacteria Treponema pallidum. So what are we going to learn in this video? We are going to learn the introduction of the syphilis, pathology of the syphilis, how can we diagnose the syphilis, how can we treat the syphilis, and what is the conclusion of the video. So syphilis or levus is a chronic venereal infection that is caused by Treponema pallidum, which is spiral in shape, so it is also known as spirochete. It is first recognized in epidemic form in 16th century Europe as the Great Pox. Syphilis is endemic in all parts of the world. Treponema pallidum, which cause syphilis, is a gram-negative and obligate parasite bacteria. Obligate parasite means bacteria which can survive outside of the human body. It is helically coiled microorganism which is 6 to 15 micrometer in length and 0.1 to 0.2 micrometer in width. Treponema pallidum has three antigens. First one is the group specific antigen, which is found in all the pallidum. Next is the specific antigen, which is only found in the Treponema pallidum, and the last one is the cardiolipin. It is the lipid antigen which is found in the Treponema pallidum and also in the body. It is identified the direct field microscopy, which we will see later on. Transmission. How Treponema pallidum can enter the body? So there are mainly four routes. First is the direct contact. Treponema pallidum can enter the body via contact with skin lesion, skin wound, any sort of skin injury, and sexual contact. Treponema pallidum can enter the body via any type of sexual contact like oral, anal or vaginal. Then congenital. Congenital means the bacterial infection which transfer or transmit from mother to the fetus or the baby, whether in the uterus or in the when fetus exiting through the vagina. The other causes like poor hygiene conditions, contaminated needles, and it also can be a blood transfusion. Pathology. How Treponema pallidum infection or syphilis can affect our body. So first one is the heart. In heart, it causes inflammation in vasa vasorum, which is supplying blood to the aorta. So it is obvious that it can cause the damage to the aorta. It causes aortitis, inflammation of aorta, and aortic aneurysm, puncture in aorta. Then in brain, it causes tabes dorsalis, which means wasting of back of spinal cord, which can cause memory loss, difficulty in coordinating muscle movements, paralysis, loss of vibration sense, then position sense, etc. Then it can also affect our other body organs like liver, joints and testes. Symptoms of syphilis. What are the symptoms one can see in the patient of syphilis? The first one is the maculopapular rash. When spirochetes attach and infect the endothelial cells in the capillary, it can cause a maculopapular rash, which is fluid with the white fluid, which is enriched in the spirochetes. There are many types of maculopapular rash which you can see in my blog. Spirochetemia. Spirochetes enter the lymph and then it enters to the blood, which is known as spirochetemia. And censure. Censure is a one type of ulcer that is formed by the infection of the Treponema pallidum. It is fluid rich with hard base, painless, and it can spread to the other parts of the body or to other person. Risk factors. What are the risk factors of the syphilis? So First one is the intercourse, unprotected sex. Obviously, this is a sexually transmitted disease and it can be transmitted from the sex. Unprotected sex. Then other one is a man having sex with man. It can also cause the syphilis. Other factors like censure and perinatal. Perinatal means congenital syphilis. Then this is the graph which shows the age and occurrence of the syphilis. So highest chances of syphilis or highest cases of syphilis in the age of 25 to 29, which is 14 to 40.30%. In age of 15 to 19, it is 7.80%. In age of 35 to 39, it is 6.40%. And in age of 45 to 54, it is 11.80%. This study is carried out in 2017 by CDC. Can you believe it? There are 10 to 12 million cases per year of syphilis. 10 to 12 million. And 5% of that cases are congenital syphilis. And 6,498 deaths per year caused by the syphilis. Comforts and syphilis are the greatest enemies of mankind. This is the quote of Alexis Carrel, who is French surgeon, and he also got the Nobel Prize in Physiology in 1912. Diagnosis. How to diagnose the syphilis? So first one is the microscopy. As I told earlier, Treponema pallidum is observed under the dark field microscopy, in which background remains dark and spirochetes light up. And next one is the RPR, rapid plasma reagent test, which is done to identify the non-specific antibody in blood which indicates the infection of syphilis. As I told, the Treponema pallidum has 3 types of antigen, so our immune response will produce antibodies which can be identified in this test. VDRL, which is venereal disease laboratory test, which measures antibodies which may produce after the being in contact with the Treponema pallidum. Then TPPA, Treponema pallidum particle agglutination, which is an indirect agglutination assay used for the detection and titration of antibodies against Treponema pallidum. Then FTABS, fluorescent treponemal antibody absorb, which is a blood test that checks for the presence of antibodies to Treponema pallidum. Then prevention. How can one prevent the syphilis? So first one and most important is the protected sex. One should always use condom while sex. Then avoid recreational drugs. Recreational drugs mean drugs which are used to induce an altered state of consciousness. It is also known as psychoactive drugs. There is an article published about the recreational drugs, and in connection with the syphilis, I have provided the link of that article in the description box. Then the screening of STIs. Before doing sex, you have to screen. You have to diagnose if your partner has any sexually transmitted disease or any infection. So it is very important. Then obviously avoid the sex with the infected person. Treatment of the syphilis. So a single intramuscular injection of long-acting benzathine penicillin G will cure a person who has a primary, secondary or early latent phase of the syphilis. Penicillin is the only recommended treatment for the pregnant woman with syphilis. Women who are allergic to it can undergo the desensitization process that may allow them to take penicillin, and for neurosyphilis, injection of penicillin G crystalline is given every 4 hours for 10 to 14 days. Then prevalence. What is the prevalence rate of the syphilis? In 2017, a total number of 30,644 cases of syphilis were reported in the US only, and the yielding of the rate is 9.5 cases per 1 lakh population. This rate represents a 10.5% increase compared with the 2016. It means in 2016 there are only 8.6 cases per 1 lakh population. In 2017 there are 9.5 cases per 1 lakh population, and in 2013 there are only 5.5 cases per 1 lakh population, and this is increased by 72.7% in 2017. So what is the conclusion of this video? So syphilis is very dangerous sexually transmitted disease which can be prevented by the awareness. Syphilis is becoming increasingly prevalent and patients can present at any stage of the disease. For the stages of the syphilis, you must visit my blog, which link I have provided in the description box. Thank you for the watching. If you have any doubts regarding syphilis, you can contact me. I have provided my email address. You can also follow us on LinkedIn, Instagram, Facebook. I have provided the links in the description box. And for more details of syphilis, you can visit my blog. I have provided link in the description box.